This week, all eyes will be on former CDC Director Susan Moneriz as she's expected to testify before the Senate Health Committee about being abruptly fired by Health and Human Services Secretary RFK, less than a month after taking that job. Now, this comes as more controversy is likely brewing for HHS as officials from the Food and Drug Administration plan to present data they claim links the COVID vaccine to 25 deaths in children at the end of next week. But sources familiar with the plan tell NBC News that the database the FDA is citing as the basis for its claim stems from an unverified database which allows anyone, including doctors, patients, and caregivers, to submit reports about adverse reactions they believe are linked to the vaccines. Joining us now is Dr. Anahita Dua. She's an associate professor at Harvard Medical School and also the founder of Healthcare for Action. Dr. Dua, it's great to have you with us. I mean, it's truly remarkable that this data is kind of being used in this way. I think it's going to spread very quickly, and we've seen how misinformation and disinformation spreads. But give us your analysis, your read of how this data is being worked into the FDA now.
Oh, unfortunately, this data is something that's based on what we call causation versus correlation. So the idea is, you know, if you look at data about kids in the summer, you'll see that shark attacks rise in the summer and ice cream cones are also sold in the summer. It does not mean that buying an ice cream cone gets you attacked by a shark. Right. And I know that sounds absurd, but we have to talk in absurd terms when we're talking about this right now, right?
Sadly.
So, unfortunately, what's happening is there is a database that anyone can put an adverse reaction into. And this is not to say that the patients that are saying, hey, I had an adverse reaction with this particular vaccine are saying something false. They're saying something true. But let's say that a child had the vaccine and then 10 days later, unfortunately, got hit by a car. That could be reported, and then you could make that connection that somehow getting the vaccine caused the accident. And that is the problem. So there's nothing wrong with dissent. There's nothing wrong with conversation. There's nothing wrong with saying, show us the data when something works or doesn't. But to just make wild claims, to scare people, that's unacceptable, and that's unfortunately what's happening here. And it's just another piece of this puzzle to basically take away the important things that science do for us and make us seem as if we are doing something on the medical side that is bad for the patients.
So just to break this down one step further, do you think that it's fair to say this is like a Wikipedia of sorts of studies where you can input your own results and it goes in without any expert vetting?
Well, at least Wikipedia has moderators, people who are trying to fact check stuff.
Don't say bad things about Wikipedia. No, but basically exactly that. But, you know, it's again, not that anyone is trying to falsify anything. We did this on purpose. We want to have this database where anybody can report if something is going on. But then, as the scientists, as the doctors, the next step is to then verify, say, you know what? There are 30 cases of X thing that we are seeing that multiple people across the country have reported. So let's go and check it out. Maybe there is an association. Now we do the scientific study. Then we tell you, hey, this is real or this is false. If it's real, we want to know that, and then we change, whether we change the vaccine, whether we change the delivery system, whatever we do. But if it's false, which is what it is now, you cannot come out and say we make recommendations based on this fake data, because like I just said, we would be telling everyone you can't sell ice cream anymore, sharks are going to get you. Ridiculous.
So all eyes are going to be on the former CDC director. Can you tell us what you might be looking for there and what may or may not alarm you about this story that's developing?
You know, to be honest, I'm thrilled that they're having this conversation with her. In fact, the name of the hearing has the word restoring truth in it. Ultimately, what she's going to do is, and what it seems like based on what she's published as well, is that she's going to sit up there and she's just going to tell the truth. What happened? And what did happen was this. Basically, she was told that she had to rubber stamp some vaccine guidelines, which she did not believe are accurate. And by the way, this doctor she's the first non-MD who has run this group in a while. She's a PhD, actually, but in immunology. And so she's very, very intelligent and absolutely knew what she was doing. And she actually said, even in her own op-ed, I am more than happy to hear the data. She said, I'm happy that Trump is saying, hey, show us what has the COVID drug done for us. Yeah, we'll show you the science. But what she was unhappy about is having this group of people who actually had been ousted initially from the immunization group that had been replaced by RFK and actually made really no sense on that, who are vaccine deniers, saying you need to rubber stamp this quickly before we have a chance to actually look at it. She was happy to take the recommendations and look at that. What she didn't want to do is just say, it's fine to go ahead. And I'm thrilled that we have somebody like that, or had somebody like that in power. And it's really unfortunate now that we have to watch this spectacle taking place in our nation's capital when we should be taking care of patients.
But as people like her leave positions of power or are pushed out of positions of power, what does that do to everyday public health workers who are trying to hold on to keep this whole thing together? I mean, even if you're just looking at the term of this administration, there's 3+ more years left here. And week by week, the sort of dismantling of all of this that you've already described. I mean, it doesn't take, you don't have to be good at math to figure out that we might be in a rough place by the end of this.
Yes.
So what does the journey look like from here? Do you think people who are doing the work well, who are qualified and committed to the real health of Americans, are they going to be able to hold on and continue doing work in these agencies, or will they all be gone?
You know, I think that they'll do it because I know people like that. All right. And actually, this kind of stuff makes them angry and makes them want to do their job better. It is going to be challenging, but that's part of public health. And, you know, honestly speaking, we have to take a step back and say that this is really not about anti-vax or pro or anything. What this is about is when COVID was happening, unfortunately, a group of people got quite angry about the fact that they were told what to do, quote unquote. And unfortunately, what's that done is that transpired into the area that we are in currently, where we're basically telling people that now we've been able to put someone in power who can do whatever he wants, say whatever he wants, and you have to adhere to it. And you're already seeing people in public health, like you mentioned, and those that are going to be coming into this line, fighting back against this, because ultimately our job is to take care of patients and the public, and we're not going to allow misinformation or information that is partially true to distract or hurt the public that we have dedicated our lives to taking care of.
Dr. Anaita, thank you so much for joining us tonight.
Thank you.
Great to see you. Up next,